health insurance sector has grown significantly in the past 2 years. Driven by favorable government policies, economic growth, product innovations, the adoption of simpler customer processes, and increasing awareness on healthcare. To keep up with the customer expectations, insurers have had to review their offerings and adopt data-driven strategies. Additionally, insurance companies have developed innovative products to offer flexible coverage and seamless service. To enlighten us more about this, I would request the eminent speaker for the session, Mr. Bhaskar Nerurkar, sir, to come up on the stage. Sir is the head of the Health Administration team at Bajaj Allianz General Insurance Company, Pune. Mr. Nerurkar has held several significant positions throughout his career, including Vice President and National Sales Manager for Bank Assurance at Bajaj Allianz General Insurance Company, and worked with Life Insurance Corporation of India for more than 16 years. He has also received various accolades such as Six Sigma Black Belt from the American Society for Quality and a certification in project management professionals. Mr. Nerurkar is an accomplished academic as well, currently pursuing PhD in health insurance from National Insurance Academy, Savitribai Phule, Pune University. He holds a master's degree in statistics from the Indian Statistical Institute and bachelor's degree in statistics and computer programming from DG Ruparel College in Mumbai. So, please address the gathering.
So first of all, let me say a few words. Our CEO, Mr. Tapan Singhal, who is an industry thought leader, he was to address this session. He had to go for urgent meeting to IRDA regulator, and I am here addressing the session. Of course, our boss can talk on many things in insurance, and I think he is a thought leader for the country. He always likes to mingle with younger minds, and he enjoys that. He relishes that, the ideas that come from it. So I stand between you and the lunch. Yeah, that's what. That's not a very good proposition. And with a very simple subject called insurance. I don't know how many of you, anybody, even I don't plan and tell my son that you will be insurer one day. Nobody says that you will be insurer one day. People want to send their children to engineering or medical. Insurance, I think that will be the last tick on the box if somebody has to missing. But in the modern life, it has become a so important facet of the life, and I'll say that we don't advertise. Insurance nowadays is not advertised. Newspaper does it for us, you know. You have seen today's newspaper? On expressway, there was yesterday a very bad accident. You know, you can say that I am the best driver, I am the safest driver. So what happened? There was some work going on expressway, and they asked vehicles to stop, slow down. 11 vehicles were standing there. A truck came from behind, lost control, piled up all the 11 vehicles. Somebody's Creta is at the second floor height. So that is what has happened. All the 11 motorists were very safe driver. So they have nothing, no fault in this entire evidence. But if you look at their cars, they are all gone, almost beyond repair. But forget the cars. What about their well-being? As of now, the news says that 22 people are severely injured, hurt. No death reported so far, but that's what I say, we don't advertise. If you read that news and don't check your insurance renewal date, then you are not learned enough about the insurance. Your car should be insured as well as your health should be insured. And health insurance is a topic that I am going to talk about today. Although it's a bit a technical topic, but we'll try to make it a bit lighter. Otherwise, you will not listen to me pre-lunch session, isn't it? So health insurance, first of all, insurance as a concept, people don't appreciate that insurance as a concept is new to India only because of our culture. If you go back just 40, 50 years, it was a joint family culture. In a joint family, you hardly required any insurance. all the needs that insurance provides today are taken care by that joint family structure. It was a community living. Anybody has any problem, community used to rush and address to those uncertainties of life, vagaries of life, but no more. With the modernization, with the urbanization, a lot of population moved towards the cities. And then there is another concept called nuclear family. Okay? So, Indira Gandhi time they used to say, hum do, hamare do. Then there came a phase they say, hum do, hamara ek. Now there is a concept called dinky. You know what is that dinky? Yeah? Yeah, double income and no kids. They don't want to say that, like there is a good stand-up comedian, no? Varun Goel or this thing. So he says that on a lighter note, he says that my parents keep on asking, relatives keep on asking, what about your family? When are you going to extend your family? So he says, why? So he says, I asked my parents why I had to extend my family. So he says, नहीं, वंश को आगे बढ़ाना है. So मैं कौन सा चंद्रगुप्त मौर्य हूँ वंश को आगे बढ़ाना है. आपने आगे बढ़ा के क्या किया? So that's on the lighter note, but that is a thought process today, and it is a nuclear family. There is nobody to take care of that nuclear family. Husband, wife, and a kid, or may not be a kid there. Okay. So I'll just reiterate a decision. I am a health insurance professional. For last 5 years I am with health insurance and 33 years with insurance. Still I don't say that I understand insurance because it's a very vast field. I hardly understand 3 or 4 line of business of health insurance, that is motor, life, health, and to some extent property. There are 15 line of business in India. Worldwide it is more than 200 line of business insurance operates in. So being a health insurance professional, I always thought that I don't need. Company provides some cover to me, and I think that should be more than enough for a person like me. I go for a walk daily morning, minimum 40 minutes. I read WhatsApp and drink, green tea. My wife is also sort of fitness freak. She also goes for a walk along with me. Only son, aging 20 to 23. If at all any medical expenses come, I can simply pay out of pocket, that's all. I don't think I need health insurance. That's what my personal thing. But yes, I bought a policy because after a certain age, if I buy policy, there will be some restrictions based on my health condition. So I have kept a policy. 23rd March 2023, last month itself, my son studies in Chennai. So at 8:45 in the night, I received a call. And I'm talking to his friend that your son is admitted in the OPD of SIMS. First of all, I started this. Then I'm telling them that see to it that best care is taken, whatever is required I am doing. My wife is listening to the call. I receive such calls, at least 10 calls a day, that somebody is admitted somewhere and we have to help. So she is thinking it is one of the official call. After keeping down the phone, I said, our son is admitted in the hospital. So she was thinking almost, what happened? Suddenly. So it was a sudden, this thing at 8:45, I received a call. She said, nothing doing. I want to go there, Chennai. 8:45 in the night. Next flight flies from Pune airport at 10:30. That's a very short span of time. So I'm trying to pacify her. I said that now that some of his hostel mates took him to the hospital. They have already spent 1,000 rupees somewhere. They have put 5,000 rupees in SIMS. SIMS did the earlier reports. Now SIMS want to do the MRI scan, 6,500 rupees. That is why his friend called me. Uncle, abhi to itna paisa nahi hai. I said, I'll GPay you, but let all test happens. Then I realized the gravity of the situation, that they are going to take him for MRI and all. So I activated my team. I am fortunate to have a health insurance team across India. So I activated my team in Chennai, and within next 15 minutes, people reach there to take care of him. This is about me. This is about me. Finally, the MRI scan happened. By that time, I was trying to book the flight of Indigo. We understood that it is acute appendicitis attack. So I told my wife, relax, nothing, this thing, it's appendicitis. He was having some symptoms in 1 o'clock in the afternoon. He took some medicine because of ache. He tried to lie down and all, but by evening it aggravated. So he told his friends that take me to the hospital. And then the rest is, I reached Chennai at 2 o'clock in the night, 2:30. I reached there, I saw my son is in OPD. I don't know, you are all from health background. So he is in OPD, lying there with all lights on, and he is unable to sleep. He is unable to get rest. So I asked hospital why he is in OPD. He said that no rooms are available. So I said, what rooms not available? He said, general ward is full. So now their insurance starts. So I asked, what is the next room available? Single private AC is also full. So what is that you have, I asked. He said that deluxe room. I said, okay, shift him to deluxe room. So he asked me, do you have insurance? Do you have insurance? Then I realized I have a policy and how needed it is. Because if I don't have insurance, pay 1 lakh rupees at the counter as a deposit. So I told them that don't worry, I have insurance, I'll give you details, but shift him to the room. So they shifted him to the deluxe room. And while traveling itself, I had asked my team to book me one nearby 4-star, 5-star, whatever it is, because I have to stay there with my wife. But my wife said that I am not going to stay in the hotel, I'll stay in the room with my son. And then I realized because I have enough insurance, I could get a proper room in which my son and wife both could take rest that night. Next morning, immediately, doctor did not even ask anything. He saw the policy first that I am sufficiently covered, and by 10:30 the surgery was done. This is the story about me, 33 years in insurance, with health insurance, heading health insurance, and not being, okay, I don't need health insurance. मुझे health में क्या होने वाला है? I will need my policy 4 or 5 years afterwards. How many of you as a young minds are here and your parents are somewhere? And all of you are a single, many of you may be single child or 2 child. Even if it is 3 child, people, your parents are worried the moment there is some episode. And that episode need not be of health. I told you about the accident that happened. Nobody's fault. Nobody's fault. I don't know, I was coming here just 3 months back, there was an accident here, and since that happens to be from our acquaintance, how many of you know there is a Nandegaon road behind this, from Nande to Pirangut, there is a road. So one of my close friends, son-in-law, he works in IT, so he was coming back very late in the night on that road. And very late in the day, 11 o'clock something. And while driving, he has kept his hand like this on the door. So the vehicle coming from opposite, right, I don't know, he was drunk or what, they just dashed his car. So his car was toppled, but this portion impact was so much that he is now undergoing a multiple surgery for this fracture, the piece of bone from here is missing. It was there on the road. So they have put some wires. I think already 4 surgeries are over. More than 6 lakhs gone. No fault of his, and perfectly healthy individual. Do you need health insurance? Yeah. This can happen to anybody. It need not be our fault. I think there was a news. That's what I say. Newspaper are the best advertisers for us. A CEO of a company going for a jog in early morning on the Vareli Seaface. She was, unfortunately, she did not survive. She was killed by some SUV driver. Accidents can happen. Infections. What about infections? How many of us say that, nahin, mere ko kuch infection hoga hi nahi. Tandurust. I think COVID changes for all of us. The first thing I asked after entering SYMPOSIUM is, do I need to wear a mask? That was my first question. Now the COVID pandemic has said that nobody, मैं प्राणायाम करता हूँ, मेरा फेफड़े अच्छे हैं, nothing. There are infections, there are antigens, pathogens in this world that will breach any system. Health insurance will not save you. Health insurance will only save your pocket. You can afford the best of the treatment. That also will not guarantee life today. And I think during the COVID time, I'll just give you examples of what happened during the COVID time and ask insurers what happened during the COVID time. People were not able to meet their bare minimum oxygen support cost. And Indians, the way innovative we are, you know, there is always a short supply. The moment COVID pandemic started, which is the most enterprising state in this country? Most enterprising in the sense they always think in terms of business. Which is the most enterprise? Gujarat. Everybody purchased 5 remdesivir injections in Gujarat, and there was a huge shortage, and they kept it in their fridge just at the start of the pandemic. Can you imagine? And the cost of remdesivir, what was the cost of an injection? Anybody has anything? 2,500 initial.
Initially 3,500.
3,500. Then?
Around 900.
I have got a Surat case of one injection costing 1,25,000 remdesivir. So what happened? What happens in India all the time? You know, there was a few, I don't know how many of you remember, few years back there was some swine flu or something. And medical fraternity is, I should say that 80-90% are very good, but the balance 20% are again enterprising. So there is some, what is that? Homeopathy pills are available, 400 rupees. So if you consume those, you will not get swine flu. So that was available in Asiatic stores there is a small Asiatic store opposite Churchgate station in Mumbai. There is a small pharmacy available there. So I told my wife that this seems to be, because you believe whatever people tell you about such pandemics, you believe. I'll buy it. So I went there for this thing. So I was trying to search the store, but I saw there is some queue. So I asked, "Bhai, ये store कहाँ है?" तो बोला 1 किलोमीटर पीछे क्यू में खड़े हो जाओ. 400 rupees का होम्योपैथी मेडिसिन खरीदने के लिए, which you know may not work, and afterwards it proved that it never worked. That is how the hysteria starts when anything, any illness or any infection starts. So what I want to say is, infection and accidents are unforeseen in today's VUCA world. I don't know, this is a Gen X term. What that VUCA stands for? Volatile, uncertainty, yeah, same thing. And erstwhile, society structure used to take care of all this, all the expenses, all the small insurance and all. But today you need insurance. Today, with a nuclear family, we need this insurance. So when did insurance come to India? I think there's a historical part. 1818, first company was set up, Kolkata, Oriental. It was mostly towards life, and somewhere in 1980s, even health insurance. Actually, health insurance was part of the regulatory guideline passed in 1912. During the British period also, when the regulatory guidelines were framed, health insurance was part of that guideline. So 1920 was the first health insurance regulation formed in this country, and we have come a long way. It's almost 100 years. Insurance itself got nationalized in 1956. Life Insurance India came into being. I am a product of LIC of India. I worked with LIC of India for 16 years, and then I joined the Bajaj Group as Bajaj Life, and then shifted to the General. That was the first. And 1973, government decided to nationalize the general insurance side. Typically, in the world economy, life insurance and health insurance go hand in hand. So if you go anywhere across the globe, health insurance is a part of life insurance, and the other insurance is P&C, that is property and casualty, what we call general insurance or non-life insurance in India. But in India, health insurance is under ambit of general insurance industry. So 1973 general insurance PSUs came into being, but the real thing happened in general insurance 1986, and this health insurance was not brought in by any insurer but UTI. They came up with a medical policy, and it was a policy which was linked with some savings part. Again, we are now thinking of, can we link, because people say, and this is a greatest joke that I hear, that my insurance money I premium paid this year, it is all waste. It's, it's, I laugh at this sentence because your health insurance money is wasted. That means this year you have not seen hospital. If your life insurance money is wasted this year means you are not passed away, you are still alive. So you should be happy, my insurance premium is wasted. But people say that, what is to do with health insurance? My entire amount is wasted. So one advice to all of you, I am not propagating my company here, but as a 33-year insurance professional in this country, if you are not buy insurance from anybody, not Bajaj, any company, servicing standards are 19-20 here and there, but everybody will pay genuine claim in this country. So 1986, that first insurance policy, medical insurance policy was brought, it had some saving position. Now again, we are trying to see same thing in the market because public demand is that. Today's generation, they are more for, it's not a generic comment, but it's an instant gratification. If I pay money, I should get something, isn't it? That is what this all mobility and all brought in. So I need not tell marshmallow experiment here. Anybody knows marshmallow experiment? Yeah? It comes on WhatsApp every now and then. Sorry? So marshmallow experiment was basically to prove that instant gratification is what not will take you ahead in life. So they experimented it with 30 school children. They gave them marshmallow and told them that if you don't eat it for next 15 minutes, you will get another marshmallow. So the moment they went out of the room, children, but those who did not eat, and they tracked this group of children for over years, where those who did not eat that and waited for 15 minutes to get the second marshmallow, were the students who achieved something. Of course, others also achieved, but the success rate of people who waited for that gratification was very high. That is a experiment. You can Google and see it, marshmallow experiment. There are other side stories also to it. So they asked the child, how did you resist the temptation to a 5-year-old kid who has got food in front of him, which he loves, he's salivating, but still, how did you stop for 15 minutes? You can see the experiment on the Google. I think there are a lot of things. So what I wanted to say is that it's the word of instant gratification today. And if you pay the insurance premium, you are expecting your mobile should ring and say that kuch to mil gaya, kuch to offer mil gaya. That is what is today's generation wants, and that's why we are again thinking of bringing in the product which is associated with health insurance, and it has a saving portion. Then, of course, everybody knows that 1991 government set up a Malhotra committee and decided that with the opening of economy, insurance sector need to be opened. The report was submitted, and by 2001, Insurance Regulatory and Development Authority of India, IRDAI, was formed with a clear mandate that they have to expand and see to it that customer interest, genuine customers' interest is protected. With that point, IRDA came into existence, and then the private insurers entered the sector, and that is the point from which health insurance started growing in India. It grew in by leaps and bounds, and by 2006, SAHI companies came. Okay, anyone can expand this acronym SAHI? Then I'll see that some people are from insurance sector. What SAHI stands for? SHI? No. It is stand-alone health insurance. So like a general insurance, like company like ours, we do business of 11 line of businesses, like motor, property, health, travel, PA, then fire, marine. So we do aviation, 11 line of businesses, but stand-alone health insurance company do only single. They are very single-minded. They do only health insurance business, and their success brought other general insurer player also to look at health sector in a different way. So by 2014, the sector really caught up. And when that competition happens in the market, the only beneficiary is, when there is a competition in market, the only beneficiary is the customer, end customer, because you get the innovative products Everybody tries to bring down the cost, improve servicing, and that was a turning point. So now we have almost 27 players working in the health insurance market in India. So that's about the current situation. So what future? Now I just want to give a different perspective, and I think a speaker before me also was talking about some social schemes. Government also understood that health protection is the most critical part for growth of any economy, because the only resource India has today is our population, our manpower. And if this population or manpower is properly trained, we are why people look at us at a powerhouse, because we have got a lot of English speaking young population. So we can do any back office of any world industry, because we have got huge talent pool of English speaking young population. But if this population, worst come worst, let us say, does not, if there is something happens on the health side and they don't come up that good, that's a huge disaster for the country like India. So government of India brought in 2003 what is called a government insurance schemes, and these, if you know, we are in a federal structure and health is a state subject. So every state government came up with their own RSBI, Rajya Sarkar Bima Yojana, and some of these schemes are very wonderful. And if you know that, if I say that from a private sector that we are technologically advanced, the government health scheme won award for technology in 2009. You know, that is a scheme which is where the beneficiary gets a card, chip card, and typically in a RSBI, the beneficiary is not known. It is a below poverty line. So BPL people, so they have to just get a 30 rupees card, and that's the only expenses. Now a lot of government sponsor also that card. So when they go for hospitalization, he has to only sit in front of machine, put his card. The officer, presiding officer of that scheme puts his card in the machine on the second side. Both do the biometric and his claim is passed. Can you imagine this is happening for the government scheme? And 2008. So not, ये विकास के पहले की बात है. 2008 में this scheme won award at a world forum for its technology advances. So a lot of state government schemes are highly technology advanced. And then of course, क्या है वो, प्रधानमंत्री जन आरोग्य योजना was announced by our Prime Minister, and that is a scheme of center. State can adopt that scheme for their own below poverty line population. State schemes are targeted at a BPL, but PMJY is targeted at ACCC, socio-economic caste census is there, and 10.5 crore families are identified in that, and the beneficiary of that scheme are frozen, okay, unlike the Rajya Bima Yojana, where the block level officer decides who is the beneficiary. So that is another extremely technologically advanced scheme, and you will see its wonder. Its wonder means in a country like India, you have some software of that quality. It is said that the software, back-end software, was designed by TCS, and every meeting of that software project was attended by none other than Prime Minister Narendra Modi. And Modi ji used to say that by 10 o'clock the meeting is over, and he used to tell the TCS guy, "Kal subah ye chahiye," and TCS delivered that. It's one of the best software. If you are interested in technology, you can just see how you can search the beneficiary of PMJY. The software that is there, it scans 50 crore data, 55 crore personal database, and just by your name and few parameters, you can see whether you are a beneficiary of that. I'm sure no one here is a beneficiary of PMJY, but if anybody comes to you, jo lower segment mein hai, workers and all, you can just, it is very easy, and I don't, it's a technology wise, since I am also with IT background, it's a wonder that such a software is created. So PMJY is a central government scheme, but many governments which are in the opposition, they continued with their own state scheme. Some of the notable state schemes, I think, is a Swasthya Sati Yojana of West Bengal. Then there was a Bhamasha Yojana of Rajasthan, but now they are also trying to So how this government scheme works, and that's why saying the speaker before me was saying, can you imagine a UP government scheme had 1 lakh rupees sum assured, okay? 1 lakh rupees तक का treatment below poverty line family को free है 1 lakh. The maximum spend that happened under that scheme is 35,000. Why? Because the people, they are living in so remote areas, they don't have access to the healthcare. So they don't reach. And whenever they are able to reach, they are hardly able to utilize that 1 lakh rupees. Under PMJY, the sum assured is 5 lakhs. But the challenge is there any healthcare? Now, let's talk about Pune. I think most of you are from Pune. So this is the only medical institution here in, if you say at least 10-kilometer radius. And this is nearer to Pune. So if you go still interior, there are hardly any medical facilities that a poor person, like the Adivasis and all, they stay in Pada and all region, they don't have access to healthcare. Government is ready to pay their cost, but access to quality healthcare is lacking. And I think that's a huge gap there that India needs to. And that's why they say healthcare is a sector in which you can really, if people start working, there are wonders. You know, Sahyadri Hospital, anybody knows? Sahyadri, it's a big chain. So, since I am from health insurance, I keep on talking to these hospitals and all. So, I had been to their this thing and I was talking to their CEO. They bought a machine worth 2 crore, surgery machine, highly, this thing, robotic surgery machine. So, where they put that machine? 2 crore rupees ka surgery machine, where they must have deployed it? Any guess? Sahyadri is there at 3-4 places in Pune. So where they might have deployed it? So I was surprised to know that. They deployed that high-end surgery machine in Karad. Because if you see at least 100 kilometers radius around Karad, there is no that sort of medical facilities available. And there are a lot of farmers and agriculturists who have got good income, but to take any treatment, they have to come to Pune. But now the situation has changed. That Sahyadri facility at Karad is equipped with such a high-level medical treatments that people don't travel. Why somebody from Kolhapur will come all the way to Pune if he can get same treatment in Karad, same quality treatment and all those. But this is a reality of today's India. Healthcare need to go, and these all corporate hospital chains, they are thinking which are the locations like Karad. If I come from Konkan, so they say if anybody gets anything serious in Konkan, they have to go to Goa. There is no medical facility. But now I think sorry? Derwan. So Derwan to Goa is I think 300 kilometers stretch. Derwan also a lot of people do philanthropy from, a lot of doctors from Pune go and this thing. But again, it is a question of speciality. You don't get speciality treatment, and there are good agriculturists, horticulturists in that belt. But for any treatment, they have to either come to this side, Karad, or go to Goa. So, quality healthcare systems are not there. Although government is ready to finance that bit, but the healthcare systems are not there because of India's geography challenges. And there is a huge gap. So, one of the CEO of one of the big chain, we were discussing, and he was saying that these top hospitals, they don't want to empanel for PMJY or government this thing. Why? Because PMJY has got a tariff in the sense how much charges you will get. That is fixed. Under a PMJY contract, your cataract operation will take only 5,200 rupees. That much government will pay. And there are medical facilities which are giving cataract operation in 5,200 rupees and still making profit. But if you go to any top-end hospital in Pune, how much a cataract surgery will cost? Anybody, any idea? 50,000. You need to go for increase of sum insured of your policy. Imported lens is around 30. It is 1.25 lakhs. So there was one customer of ours. He was in Mumbai, IT customer. He wanted to go for a cataract surgery and stay in the hospital. And the hospital stay, that room charge for a day was 1.75 lakhs. Only room charge. Suite. No, he want to take his father. So he told me that, and if I tell you his agreement, you will say that he's right. He said, I am paying premium for 10 years. I have not taken a single claim from your company. So first time I want to take my father to 1.75 lakhs print suit for his cataract. What is your problem? So the cost of room plus the cost of lens and all, everything will go in the range of 5 lakhs. And I think many youngsters over here may be having that wish list, that if anything my father or my mother needs treatment, that has to be in the best facility. I had to convince him a lot. I wasted almost half an hour and brought him down to some reasonable cost. In insurance, there is a concept called reasonable amount that we can finance. We can't missing. And you will not believe what sort of medical facilities are available in India. So what is the highest room rent charge that is available in India in any hospital? Any guess? Sorry?
You said recently, sir, 1.75.
1.75 is a bare minimum. So there are hospital rooms available from 2.5 lakh onward. So being a health insurance, I just want to see what is there for 2.5 lakhs a day. You don't get a 5-star room at that cost in most of the cities. So that room has got a patient care. Then there is a 3-bedroom for his family to stay. Then his Khansama and chef. There is a conference room from where he can do the VC with his team and all. So because one of our customer was MD and he wanted that room. So we had to agree because of his high sum assured status. But I just wanted to know what is there they are offering at that cost. Because 2.5 lakh a day. So India, the gap is between the quality and cost of treatment is too huge. Like they say, na, in a city like Mumbai, you can have your lunch at 15 rupees maybe lunch ho sakta hai, and 15 lakh ka bhi lunch ho sakta. So, but everything is available. 15 rupees se 1500 ka bhi hai, 15,000 ka bhi hai. But healthcare is not like that. If you cannot afford that 5 lakh ka treatment, the next is, I don't want to take this name, but Sassoon. So, where you never know that you enter for one thing and some other infection may catch. People like us have that fear. Although it's a good government facility, but the total hygiene and all, we feel that it's better to go to the. So in healthcare, there is no staging. There is no stage-wise available. You have either these government facilities or you have something like Ruby's and Jahangir where we want to have the treatment. So I think I have been given only 5 minutes. 5 minutes for the questions or? So the state government schemes and government of India schemes, where I came from, there are some high-end hospitals which are now trying to empanel for PMJY because it's a huge revenue. If you are in the hospital industry, you cannot forego that. You can't say that I will not enter into. So I was discussing a business model. It's like, in city like Mumbai, there were chawls. So when these chawls were demolished, they built their towers. But what they did, the 2-3 floors of that tower is given to the chawl people. For them, entry is also different. But people who come for tower, they have got a nice porch and that entry gate is different. Hospital industry can look at a model like that if you want to serve the PMJY customer, some facilities, and then you have your high-end facilities also on top of it. Advantage is, lot of doctors today want to do philanthropy. They want to do it for the poor people without any cost. So somebody is there in the high-end facility, he'll say, okay, I'll give weekly 2 hours in the PMJY scheme also. And not just doctor, why not nurses? If you ask them, they'll say, okay, I'd also like to work free. So that facility will have that will be low cost facility which can of course cater to the PMJY, and the facilities other infra is like a 5-star facility. I think I will wrap up here. There is government is planning universal healthcare. I just touch upon the last topic, just 2-3 minutes. So what happens is government is taking care of this 10.52 crore families, that is PMJY or some RSBAY. Top 17% population is covered by some corporate insurance or they buy their own this thing. But there is a huge population of 40 crore in between. That is called missing middle. That is a term now. So this missing middle, they don't have any health protection. Who is the missing middle? It is your maid who is working. It is your driver who is working. He first of all doesn't have that sort of money to buy the health insurance that is available in the market, and secondly he doesn't believe in it. But can you imagine, these are the families, they are now saying that if you ask your maid or your driver, their only goal in life is mera bachcha padna chahiye. They know that if my son gets education, entire family will be lifted out of this condition. If such a family which lives in what we say in Marathi, hatavarcha pot, if they are stuck with a health incidence, what will happen? They will be pushed back by many years. And then these same children, bright minds, they will be found in frustration, some other crime or something entering some. So it's a societal problem. And this missing middle, Prime Minister has announced that he wants to address this. The model that they are thinking is the PMJY tariff, but the premium will be contributed by that family. Many health these things are not ready to accept that because that will bring down their revenue. But there are a lot of things going around, but that missing middle is a huge problem for India today. It is the aspiring population which is most deprived of the health insurance. With this, I think I end my thoughts on health insurance. I hope I am able to generate that enthusiasm. So go and check your insurance policy renewal. Thank you. Thank you all. Thanks for a wonderful listening. Any question I'll take.
I'm sure the audience has much on their mind, but we request only one question to be asked because...
Thank you. I seem to be the chosen one. So I feel very connected to Bajaj Alliance actually because I receive 2-3 phone calls every week from them. But my question, sir, is one. I agree that PMJY Yojanas and Rashtriya, whatever state insurance schemes are there, they are there. But what I want to ask you is, has anybody done any research on actually, suppose if I take example of say one surgery, say hernia surgery, they will enforce a certain tariff on it, which cannot be negotiated. And the hospitals or healthcare providers are meant to take it up. But where that figure comes from, nobody tells us. Has anybody, they say, okay, government mein jayenge to free hoga. But it is never free, sir. It is paid for by the taxpayer. So if the same hernia surgery, has anyone done any cost analysis or maybe an ICU admission for one day in any government setup, how much it costs? And then is that equated to that figure or it is just from thin air that it is plucked out? Because in my experience, sir, if you calculate the cost analysis of the same procedures, which all these PMJY and other health insurance companies are saying the tariff is a must, it will be less than 5% of what the expenditure in a government setup is. And those tariffs are forced. So I would like to hear your thoughts on that.
Yeah, I think there is much to be talked about on PMJY, and I'll rather go to the first part is quality of healthcare, and of course there is auditing and all. Is there data available that those who have got treatment under PMJY, their post surgery? The most common thing that comes now in from my experience of health insurance, and please listen this carefully, if there are 100 hospital admissions, at least 10 to 12% are repeat. Means some complication coming out of the earlier treatment, either infection or some missing. So, is there a data available of PMJY? Data is available but not published. Cost value of the treatment. value of the treatment, is it commensurate with the kind of treatment they do? The tariff is forced. And again, I'll go back to the most enterprising state of this country. You know, we were there in the PMJY program for Gujarat. Suddenly you see the knee replacement surgeries in PMJY going high. Then, see, all the government guidelines are wonderful and people. So PMJY had this thing that if your name is not there in the ACCC, that hats off to Mr. Modi on this, that the way administration is done. If your name is not there, they had kept one provision that a talati can write a letter and make you part of that. So a lot of people in Gujarat realized the kind of implant they are using in this knee replacement in Gujarat, that was very high quality. So people who can afford good treatment gave 5,000 rupees and got the certificate and went for that. So, but there is a quality of treatment. One thing I'll guarantee that it's not far off, like 10 to 12% of admission. There's a value attached to it. Is it sufficient? That is your question. Yeah.
Thank you, sir, for sharing your perspective based on your experience, personal experience as well, on the present health insurance landscape in India and its future. Your speech was certainly a great contribution to today's event. Now I request Dr. Alka Chandak ma'am, Director, Symbiosis Center of Healthcare, to please felicitate Mr. Bhaskar Nerurkar, sir.